This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, January 27th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Public Views about Opioid Overdose and People with Opioid Use Disorder. Researchers completed a national web-based survey of 1,552 adults in the United States in April 2025 to assess perceptions of opioid overdose deaths and opinions of people who use opioids. Those who responded primarily identified as female and aged 30 to 44. Political views varied. 28% identified as conservative, 39% as moderate, and 31% as liberal. Most respondents viewed opioid overdose deaths as serious. Respondents felt that people who use opioids and pharmaceutical companies were most responsible for reducing overdose deaths, with more liberals identifying pharmaceutical companies as responsible, while moderates and conservatives more often identified individuals as responsible. Of the respondents, 38% reported they were unwilling to have a person with OUD as a neighbor, and 58% were unwilling to have a person with OUD marry into their family, with higher percentages of conservatives than liberals endorsing these beliefs. Next is an article in the Journal of Substance Use and Addiction Treatment titled Differences in Buprenorphine Initiation and Retention for Opioid Use Disorder Between Primary Care and Substance Use Disorder Specialty Care Settings. This retrospective cohort quality improvement study examined outcomes for 686 veterans with OUD who initiated buprenorphine in either a primary care or PC or SUD specialty care setting between 2018 and 2023. Data were derived from Phase 1 of the Stepped Care for OUD Train the Trainer initiative within the Veterans Health Administration, which sought to improve provision of MOUD within primary care, mental health, and pain clinics. Overall, similar rates of retention were found for both PC and SUD sites. Patients seen in PC settings were more likely to be older and married, while individuals with unstable housing were more likely to initiate buprenorphine treatment in SUD specialty care. Our next article is also in the Journal of Substance Use and Addiction Treatment and is titled Addiction Care Outcomes Between Insured and State Opioid Response Grant-Funded Patients in a Medicaid Non-Expansion State. To improve access to MOUD, State Opioid Response or SOR grants targeted underserved groups, specifically underinsured and uninsured populations. Researchers used electronic health data to evaluate treatment outcomes for patients who received MOUD through SOR grants versus traditionally insured patients. In an adjusted analysis, researchers did not find any difference in treatment engagement, MOUD adherence, or non-prescribed substance use between the two groups. Researchers found that the SOR grant-funded group did have a longer average length of stay for hospitalization. Authors suggest that the grant-funded group may have had more clinical and psychological complexity, but also that many intensive outpatient and residential programs do not take SOR funds, thus impacting hospital discharge planning. Next is an article in Tobacco Control and is titled Where There's Smoke Less There's Fire, Viral Oral Nicotine Pouch Content on TikTok and Market Growth. Oral nicotine products or ONP use has increased in the U.S. since their introduction in 2014, with concern about use among youth. Given TikTok's popularity among this population, researchers sought to evaluate links between ONP memes on TikTok and potential increase in ONP sales. Researchers assessed U.S. ONP sales between January 2021 and October 2023 and found that sales growth was stable until a significant increase starting in a 4-week sales period beginning mid-March of 2023. Researchers also found that there was a spike in ONP content on TikTok between September 2022 and January 2023, and a subsequent spike starting July 2023. The authors suggest a reciprocal relationship between prominence on TikTok and ONP sales, and virality on TikTok reinforces normalization of ONP use among youth. Next is an article in the New England Journal of Medicine titled Smokeless Tobacco and Oral Cancer in Global Perspective. Smokeless tobacco, or ST use, is a leading yet preventable cause of oral cancer and premature death worldwide. Over 360 million people across 140 countries use ST, with the majority in low and middle income countries, particularly in South Asia. Classified as a Group 1 carcinogen, ST products contain varying levels of harmful compounds, often including areca nut, another carcinogen. Oral cancer incidence continues to rise in regions with high ST use, notably India, where it constitutes most tobacco consumption. Despite evidence showing that behavioral counseling and pharmacologic interventions like varenicline and nicotine replacement therapy promote cessation, clinical attention to ST remains limited. Health professionals can play a pivotal role by identifying users during routine care, counseling them on cessation, and detecting precancerous lesions early, thereby reducing the substantial global burden of ST-related oral cancers. Our final article is in JMIR Formative Research and is titled Acceptability of and Implementation Supports for Video Directly Observed Treatment to Enhance Methadone Dosing Flexibility in a Multi-Site Opioid Treatment Program, Qualitative Rapid Needs Assessment Study. Directly observed therapy, or DOT, for methadone dosing has been the norm in opioid treatment programs, or OTP. During COVID, requirements for DOT were relaxed to allow increased take-home doses up to 28 days. Concerns about loss of accountability have led to pilot studies of video DOT as a middle ground. Patients download a smartphone app that records a video of dose ingestion as well as the medication bottle. Tamper-proof bottles address concerns about diversion. Videos are then reviewed asynchronously by clinic staff. This study analyzed OTP staff opinions prior to implementation of DOT at a large OTP in Washington state. DOT was felt to benefit patients traveling long distances to the clinic or those with disabilities. DOT could allow take-home doses for patients who otherwise couldn't qualify and facilitate more rapid dose escalation. DOT is part of a future where in-person clinic dosing becomes less common. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.